welcome back to Practically Pediatrics. I'm Dr. Marianne Iskander. Today we're going to talk about those rough, ashy babies that we love so much. I can say that because my child was a little rough and ashy. Of course, what I'm talking about is eczema. Let's get into it. So eczema is actually an immune response that manifests in the skin. I think most of us already know what eczema looks like. If you don't, good for you. Eczema is that skin where you have those round, red, pink, inflamed areas. They're very itchy, it's flaky, it's dry, and it can happen anywhere on the body. In infants, a lot of times we will see it on the cheeks, but we can also see it in the creases. So this kind of crease right here in the arm, behind the knees, but sometimes all over the back and the abdomen as well. Why does eczema happen? There's a few reasons. One, you're just lucky with good genetics. Number two, sometimes it will be a sign that your child might have an allergy to food or contact dermatitis. Sometimes it's detergent you're using or the soaps that you're using. And sometimes it is just due to a climate change. So if you travel on vacation, for example, and you go to a drier climate, your baby's skin will dry out even more and get irritated. And sometimes the opposite. Sometimes if you go to a more humid location, all that extra sweat will start to irritate the skin and cause this immune response. So with eczema, there's two things going on. It is dry skin with inflammation underneath. So the treatment involves usually two modalities. So number one, we're gonna treat the dryness. You're gonna look for a colloidal eczema moisturizer for infants. Usually it'll say with oatmeal extract in it. Oatmeal is a naturally calming component, and colloidal means it will penetrate the skin deeper than just a regular moisturizing cream that might just sit on top of the skin. The second part of it is the inflammation. For that, we are going to prescribe a steroid cream. So like I said before, eczema is an immune response in the skin. So a steroid will stop the immune response. So the steroid is for the redness, inflammation, and itchy component of it, and then the moisturizing cream is for the dryness. So we have to use the two together. The moisturizing cream you're gonna use every day, even multiple times a day if you need it. The steroid cream is more of a regimen. So it's going to be applied twice a day, not all over the body, only to the affected areas. Twice a day for a maximum of 7 days at a time. Of course, we don't want to overuse steroids because steroid creams will have side effects. It can thin the skin and make the skin barrier weak over time, so we want to use it just as needed. If you're using the steroid cream and you notice the redness, the inflammation, and the itching is gone within 2 or 3 days, you could stop at 2 or 3 days. You do not have to go the full 7 days. So you're going to moisturize the skin all day, every day, no matter what, whether your child is having an eczema flare-up or not. And the steroid cream is only gonna come in during the flare-ups. For those of you that wanna stay away from steroids and have a little bit more cash in your pocket, there are non-steroidal creams that will help the inflammation. So you could talk to your doctor about that option if it's appropriate for you. The other part of the treatment is to try to avoid drying out the skin. So mainly with bath time, I know kids usually love a bath, but we have to keep the baths as short as possible. The longer your child stays in the bathtub, the more natural oils are getting dried out of the skin. So 5-minute baths, should not really be like playtime baths. Try to avoid bubble bath or extra chemicals in the water that can dry your child's skin out. And also with the cleansers, you want to avoid soaps like a bar soap. You want to use something like Dove or like CeraVe or Cetaphil. Make sure it's for babies and kids. Try to avoid adult products. And also try to avoid really hot water. I mean, you shouldn't be putting your child in very hot water, but just keep the bath just warm enough till they're comfortable. So the hotter the water is, again, the more it's going to dry your child's skin out. Also, if the reason for your child's eczema is an allergy to something, we want to try to avoid the allergen. So your doctor might suggest allergy testing if your child's eczema is really bad or you're starting to see a pattern. We'll try to avoid that going forward, and hopefully your child's skin will improve greatly without the trigger. Also watch anything else that will be coming into contact with your child's skin. Try to use a hypoallergenic detergent. Try to use a hypoallergenic detergent. Dreft is the most common one and the one that you're gonna find easily in the stores. There is no fragrance and it's super mild, so that will further avoid harsh chemicals coming in contact with your child's skin. There are a couple complications to look out for. Because eczema is flaring up the skin, that means your child is most likely itching, which is opening up the skin barrier, so they are at risk for bacterial skin infections. So if that red patch is getting wet looking, crusty, or there are like pussy bumps overlying that patch, you have to call your doctor. You might need a course of antibiotics to treat what we call a super infection. It's not like super, it's like super, like on top of super infection. Also know that once the inflammation and the redness and the itching goes down, your child might be left with discolored patches of skin, which is expected. I mean, the inflammation and the immune response will sometimes also kill the pigment cells. So you might be left with these really big white patches of skin. But I will assure you, those are not permanent. Those will fade away over time. The more we get better control of the flare-ups, that hypopigmentation we see should decrease over time. And I promise you, eventually, once your child goes out of the eczema, the skin will be supple, soft, beautiful, gorgeous. And it will be, hopefully, in the past. The most important thing to understand about eczema is that there is no cure for eczema. I cannot cure your child's eczema, so stop calling me. Your child will eventually grow out of it. There's a small percentage of kids that won't grow out of it and they will have adult eczema. That is not that common, so hopefully your child will eventually grow out of it in early childhood or adolescence. The only thing we can control is the flare-ups. So just know that anytime your child's skin is gonna flare up, you know exactly what to do. You can call your doctor and get guidance about the steroid cream and then give them some extra moisture to that skin, and that should calm it down quickly. See this kid right here? That one on the left. That's my ashy little love bug. He's 4 years old. He did have pretty bad eczema in his earlier childhood years, but I will say now, his eczema is pretty much cleared up, but it's because we found the right products for him. I will tell you what I use. You don't have to get these products, but this is what worked for him and decreased the flare-up. So I bathe him in the Baby Shea Moisture head to toe wash. And then for after the bath, I douse him in Aveeno eczema therapy cream, which is honestly one of the cheapest ones out there on the shelf. I have used a myriad of, you know, creams from cheap to expensive to organic to hypoallergenic. For him, his skin likes Aveeno eczema therapy. Go figure. For those kids with eczema that are really hard to control, please talk to your doctor about maybe changing the regimen. Maybe it's just a product change that your child needs. Maybe it's a higher potency steroid. Or maybe for those really stubborn cases, or those cases that are really extensive all over the body, your pediatrician may need a consult by a dermatologist, and we can come up with a more specific plan for your child. All right, thank you so much. I'll see you soon.